Buenas tardes. Thank you so much for joining us. We're absolutely delighted to welcome you to this event on the occasion of launching this viewpoint article, Code Red for Health Response in Latin America and the Caribbean, Enhancing People's Health Through Climate Action. I'm Jenny Miller. I'm the Executive Director of the Global Climate and Health Alliance, and I welcome you on behalf of the Alliance. And also we serve as the Secretariat, and I would like to welcome you on the behalf of the Climate and Health Network in Latin America and the Caribbean. As people are continuing to join, I'll let you know that this event is, that there will be simultaneous translation, Spanish and English. If you'd like to access translation, please use the globe button on the bottom of the Zoom toolbar to choose your preferred language. Mientras personas se siguen uniendo, les hago saber que tenemos traducción simultánea para español y inglés. Utilice el icono de globo terráqueo en el parte inferior de la barra de herramientas de Zoom para elegir su idioma preferida. I'll now turn the floor over to Dr. Stella Hardinger to give opening remarks on behalf of our convening partner for this event, the Latin American Center of Excellence on Climate Change and Health. Stella, Dr. Hardinger, over to you.
Hola, buenas tardes a todos. Muchísimas gracias, Jenny.
Hello, good afternoon, everybody. Thank you, Jenny, for being here. Well, as Jenny said, my name is Stella Hardinger. I'm the director of the Climate Center, the Latin American Center of Excellence in Climate Change and Health of the Peruvian University. As climate, we have the mandate of doing research and disseminating effectively and easily the scientific evidence that we generate so that everybody can have access to that information. This viewpoint, this publication called Code Red for Health Response in North America and Caribbean looks to echo the call of Red Alert for Health of the 2021 Lancet article on climate change and health, where it's very clear what the global difficulties are, which we're going to have to face. It leads global leaders to commit to urgent actions to reduce the greenhouse gases and to address the negative trends of the impacts of climate change on health. Out of the 44 indicators that are annually monitored in health, adaptation, co-benefits of mitigation, economy, and economic policy, they're all worsening. As Latin American people, we will also face the same challenges, social, climate, and health related. And together, researchers, civil society, politicians, and companies, we have to identify the ways in which we can transform these challenges into opportunities. And through adaptation and mitigation, these must put the health and well-being of people at the key center of our public policies. This is quite a brief summary of what the viewpoint is, but I will now introduce the main researcher of the Clima Center, Marisol Iglesias, so that she can actually give us a summary of what this marvelous article talks about. Thank you. Well, thank you, Dr. Hardinger, for your introduction. Just let me know if you can see the screen properly. Thank you. Okay. Good afternoon to everyone who's here with us today and representing all the authors of this article and also to the network. I will just show you very briefly what we have created, and we have called it Red Code for Health Response in Latin America and the Caribbean, Enhancing People's Health Through Climate Action. Just like all the regions around the world, the COVID-19 pandemic has left a great mark in the Latin America and the Caribbean area. We have been able to see how inequalities have deepened and also the long way we have ahead of us to strengthen our health systems, as well as the economic injury that has led us to a period of recession. However, the sanitary crisis comes together with a crisis that may look silent or maybe even far, but which will magnify the problems for people's health, which is the crisis of climate change. Our countries, although we emit relatively low greenhouse emission gases, we have to achieve the goals that the Paris Agreement set out. And despite the growing evidence there is about the impacts of climate change on people's health, our nations and territories are still giving a response that is proportional to the risks they see. So as Dr. Hartinger mentioned, in this article, we echo the red code for health that the 2021 Lancet report gives about climate and health that are superposed on our area, and we are moved to change these challenges into opportunities so that they put the health and the well-being of the people at the center of the public policies. In this article, we also took the advantage to make a call to the governments of Latin America and the Caribbean to promote resilient health systems to climate so that we can all have quality access to healthcare. Latin America and the Caribbean is a territory that encompasses 34 countries, a very rich cultural landscape, a vast biodiversity, and it's also the place of 40 million indigenous people. But as rich as and diverse we are, we're also carrying great economic and social inequalities that have been deepened and exacerbated by climate change, affecting disproportionately to the most vulnerable populations. And this is because our region is shows quite big differences, and health is not an exception. This is because even though the expenses in health in Latin America and the Caribbean has gone higher, it's quite despair. It's not, and we have insufficient funds, and that could make countries even more vulnerable to climate change. It's worth noting that having resources, it does not guarantee that things are going to be done or that more sustainable and resilient healthcare systems are going to be created. On the other hand, another effort that is that although our per capita income is 4 times lower than those of high-income countries, the impacts on our population cannot be underestimated. And it is that we're saying that the Lancet Countdown article gives us a red warning for health, highlighting, among many other impacts, on the probability of the dengue, chikungunya, Zika illnesses, especially in Brazil and Peru, and also the increase to the cases of heat waves. And this has very high social and economic impacts. For example, the economic impacts of the Maria hurricane was really high. The costs were equivalent to 260% of their GDP, and almost 30% of the population was forcibly displaced. The challenges that we have mentioned to share many drivers induced by humans that we can change into opportunities. Here we have just a short list. I will limit to a few. And for example, we have the opportunity that international give us to address both climate and health crisis. And one of these is the program of the COP26 health area. And it's crucial that we have the commitment of the developed countries in this, as well as the imperative that they have to finance actions to prevent and address the losses and damages caused by climate change. So that Latin America and the Caribbean can decisively respond and in a transformative way to climate change and health is essential, not only to make sure that there are elements to be implemented, but also to facilitate the effective access to these resources. However, when facing the pandemic of the COVID-19 and the climate crisis, all countries are called to action, regardless of their development level. And the largest economies of the Latin American and Caribbean area are invited to lead by example. And as part of the message we want to give out in this article, how the health sector is a key player in what respects to the incidence, the articulation of the needs of climate action, and the establishment of bridges between players, because this is a strategic area for the intersectoral action through the perspective and argument of the co-benefits in health. In general, people who are in the health area have credibility and have the trust of most societies, and can be advocates to design climate dynamics that can improve the well-being of human beings. They can also be success reference for, in case of resilient and sustainable healthcare services, also helping to improve the quality and the accessibility of the care given. But as you can see here in the picture, the health area is also becoming a player in the climate negotiations at an international level, as was seen in with the participation that was unprecedented of health professionals during the 26th Conference of the UN on Climate Change in Glasgow. More than 50 countries of all over the world joined the health program of the COP26 that called countries to present national commitments to develop healthcare systems that were climate resilient and climate systems that were sustainable and with low emissions. And we're proud to say that we have countries of the regions that actually signed the agreement, like Argentina, Bahamas, Belize, Chile, Colombia, Costa Rica, Jamaica, Panama, and Dominican Republic. As a conclusion, the evidence shows that the trends in critical climate areas are worsening, exacerbating poverty and inequality due to the late responses of the countries. The countries of the region must take action towards climate as an opportunity to improve the health of the population. We make a call to our governments to raise their environmental will and take actions that will make sure that health and healthcare is in the middle of the national and regional response to climate change. The component of health must be strengthened in the instruments of climate instances, in particular those determined at national level, and the national adaptation plans. And on the other hand, we motivate the health area to carry on working so that they become this articulating agent that breaks through the barriers and leads to the co-benefits in health together with all the other players. We thank all the organizations that are part of the network in Latin America and the Caribbean who helped with this viewpoint. And thank you all for your attention. We invite you to read the article that is being shared in the chat. And without further ado, I'll present you Mauricio Lavaca, president of the Medical College of Chile. Well, thank you, Marisol. Apparently, I have bandwidth problems, but I can't open my camera. Now I will give the floor to the editor-in-chief of the Lancet Regional Editor, Dr. Thais Avila, to talk about how this region gets strengthened with this publication and how Health America is a key player in the communication of science and the call to action.
Thank you, Stella and Marisol, for doing this. Such a great event, and it's amazing to discuss the paper with such a great panel of specialists that you put together. It's really fantastic that we're able to make the message reach so much more people than we would do with just a regular publication. So kudos to you for doing this, and thank you for inviting us to be here. So from the journal side, the way I see it and the way we believe is that the way that the viewpoint puts the countdown points in a frame and reporting it into the local perspective. So you take a global report and you put into the Latin American Caribbean perspective. And the publication is successful in calling the attention to key areas that are important for those countries and the most urgently act on. And what's important here is that you use local successful examples also. So by doing this, I think you have a more compelling case for leaders. So you use examples like Costa Rica putting the aligning the NDCs with the Paris Agreement, and the way that Argentina successfully put it, the NDCs as a guiding axis as health as a guiding axis to define the NDCs. So there's a direction, and you're using those examples to highlight how we can do it. So, and the publication sensibly brings both shared vulnerabilities and the heterogeneities of the region, which is very important. So you're able to call for intersectoral action, but it's also tailored to specific geographical difficulties. And in that sense, we believe that having it published in a regionally focused journal will help strengthen the message. And that's what we hope. And as a journal, we expect to use our credibility to echo the capacity to help elevate and expand the conversation. So by using our journal as a platform to give voice to you, the actual health professional and climate scientists that are the ultimate people that can make a difference and influence policymakers and government decisions. And we hope to be the right platform to give voice to you and reach out to the right people at the right time, which is now. And I hope we are not, this is just the beginning of our partnership, and I hope we can do a lot more together in the sense of the countdown and to echo the message that starts with this viewpoint. And I'll just leave the floor to the next person to go on. Thank you so much.
Muchas gracias, Taisa. A continuación tendremos un panel de discusión.
Thank you, Jason. Now we'll have a discussion panel with representatives of different organizations that are part of the Climate and Health Network in Latin America and the Caribbean. While the panelists explain the point of view, I invite you to write questions for them in the question and answer section of the screen. We'll do as much as we can to answer them, or we'll contact you after webinar so that we can answer them. Firstly, I will give the floor to Dr. Daniel Buss, who will talk to us about the climate change and health agenda in the countries of the Americas. Dr. Buss is an advisor on climate change and health of the Pan American Health Organization in Washington, D.C., where he also coordinates the agendas of biodiversity, green areas, and their effect on the human health. Please go ahead. Thank you, Mauricio. Thank you, colleagues and friends who are here in this panel, and also those of you who are listening. I see many names that I know from many of the countries where we're working on. And it's an honor for us from the OPS to be here with this group, with this network, and as part of this viewpoint. And as Taisa was saying, we hope that this is the first of many publication collaborations that we have among entities. We are working with the countries in the Americas for a few years now. We have managed to build some plans at a multi-country level. I also have mandates for countries of the Latin American area within the climate change and health area. And among the key points, I think this paper has worked on some of the fundamental points that countries have mentioned as being the key points for action to move forward with the implementation of a climate change agenda and health in Latin America. Maybe the key point, the number one in priority, should be improving the governance and the structures, institutional structures, to guarantee that the health is part of this governance structure. Without that, there's no way health can incorporate their data, their information, their key information in a comprehensive way with other areas so that we can take a joint action. This is key, and we have to guarantee that evermore's health is represented in these interministerial meetings that are happening, and that it appears in the structural and regional climate change structures, having health a leadership role together with other entities and other areas, because it is just essential to guarantee having structures or actions of adaptation and mitigation also within the health area to reduce the greenhouse gas emissions and to prepare for the impact of climate change on the health of the population of the Americas. Having the governance structures already with a health area actively participating would allow us to include, for example, the topics and issues of health in the national planning for the adaptation of climate change and the vulnerability and adaptation studies in matters of health, the NDCs, the contributions not only for the countries, but also the long-term strategies that the countries are now developing for the UN framework meeting, and another one for climate change, and others, and other agreements at an international level. Also, being within these governance structures guarantees that we can include some of the health issues and health priorities into the planning programs for financing, the budgetary and investment plans of the countries through the Recovery Fund or other structures that are already there to finance climate action in the Americas. And a little bit of what topics we can have after having this push for intersectoral work. What can we include in these plans, in these financing structures? Now we will hear from other colleagues, and I will give the floor to Mauricio later, some examples and some actions that we have identified that appear on this viewpoint, but also other entities that are part of the network that help us a lot to implement them. But it's not possible because of the complexity of this area to work in an isolated way. We have to build these networks, and that is the role of this viewpoint, not only of sending a message, a red code, but also to send a message of hope that we're actually jointly working with these entities to move forward to create a comprehensive agenda for climate change in the Americas. The theme of surveillance in health as an integrated way in climate, environment information, and demographics is also essential. The support to infrastructure and services and health services that can reduce their carbon footprint and also work in particular now after extreme climate events, for example, when they are the most necessary, to increase the study of co-benefits to health of these interventions that are out of the hands and are the mandates of the health area, for example, in green areas, in food systems, in the change of the energy matrix, transportation. So all of these actions are essential so that health can be promoted, and ultimately to increase the capability of research and training, not only for health area professionals, but also for the population in general, so that they can understand the links between climate change and health. Now we will hear from Mauricio. Thank you very much. Now the floor is his, because I think we're going to also listen to some of the examples of the points that we have written in this paper together. Thank you for having us here with us, and count on us in the future. Thank you, Daniel. Now it's the turn of Dr. James Hospedales, who's with us from Trinidad and Tobago in the Caribbean. Dr. Hospedales is a doctor and is running health medic and health nurse, which work on mobilizing health professionals to address climate crisis and health. Doctor, tell us, how does advocacy in climate policies and health promote the health of people, and how is this advocacy strengthened? I can tell you that you can activate the simultaneous interpretation so that you're going to hear the presentation in Spanish. Thank you. Please, doctor, the floor is yours.
Gracias. Muy buena tarde a todos. Gracias por la oportunidad. Earth Medic and Earth Nurse is happy to be part of the Global Climate and Health Alliance and Red Clima y Salud in América Latina y el Caribe. Advocacy by civil society is an essential part of nearly all major change. Examples include HIV and AIDS, environmental protection, maternal and child health. Climate advocacy aims to persuade policy and decision makers to do things differently, to put the health of people and the environment above profit. What is at stake is huge. Patient Earth is sick, and the signs and symptoms are getting worse. For example, the increasing heat on the land and in the ocean, the superstorms, the rising sea levels, and the massive loss of biodiversity. In 2016, I realized that most of the public health problems that I had faced in my career, epidemics and pandemics, natural disasters, chronic non-communicable diseases, were all connected to climate change and environmental destruction. At the root of this is a lack of respect for the interdependence of all of creation. I also realized that most health professionals were sleepwalking, unaware of the seriousness of the climate threat or what they could do about it. That is why in 2020, I founded Earth Medic and Earth Nurse to give health professionals the courage to stand up and speak, to be white coat diplomats, to advocate on behalf of patient Earth. Nuestro logotipo muestra la Tierra como un círculo verde y con una cruz blanca, el símbolo universal de primero auxilio. Alrededor de la Tierra están los vientos de una poderosa tormenta. Earth Medic is a not-for-profit organization headquartered in Trinidad and Tobago, and it aims to mobilize health professionals worldwide to take action to improve planetary health, beginning in the Caribbean. Our goal is to have 1.5 million members in 5 years in at least 100 countries. What do? We advocate for action by people, business, and policymakers to benefit health and the environment. Last October, we held a landmark conference on climate change and health in small island developing states with over 25 partners to give more voice to the South and the vulnerable islands in the Caribbean. We are advocating for the inclusion of climate change in the curricula of the 40 health training institutions in the Caribbean. We support Doctors for Extinction Rebellion in the UK in their non-violent direct action to draw attention to the climate and health crisis. We deliver training to create a more climate-educated health workforce, to equip and empower them to act. Currently, we have a Caribbean Climate and Health Responders course jointly with the Global Consortium on Climate and Health Education at Columbia University and the Caribbean Institute of Meteorology and Hydrology. I'm happy we have over 1,000 participants from over 30 countries, doctors, nurses, environmental health, mental health, students, and many others. We support research for action on climate change and health and are working on a study of the views of health professionals on climate change jointly with the George Mason University. We're working to finalize a research for action agenda on climate change and health jointly with Emory University, PAHO WHO, the University of West Indies, and Yale University. In conclusion, Health professionals are the natural champions of climate mitigation action. Climate change is a big agenda, and there are many leaders. Earth Medic and Earth Nurse looks forward to joining forces in the network for better collective impact. I thank you.
Muchas gracias, James, por tus palabras y tus importantes mensajes.
Thank you, James, for your message and your important remarks. Now we will ask Andrea Hurtado, manager of the Committee for Latin America from the International The question is, how can the health area promote the health of population in terms of climate change? Thank you, Mauricio. I love to be here representing Healthcare Without Harm. Thank you to the Alliance. Thank you to Clima for all the efforts behind the organization of this webinar. And well, I'll go straight to the point because I don't have a lot of time. We have talked a little bit already about the multiple impacts of climate change on human health and the response, or sometimes lack thereof, that Latin American governments have given from their climate policies. But in this discussion, sometimes we need to acknowledge that in the health area, we have a key player able to mobilize their huge ethical and economical influence to promote the radical changes to keep alive the goal of limiting the increase of the Earth's temperature to 1.5 by the end of the century. And to talk about how the health sector is promoting adaptation mitigation policies, we have to see that this is a dual-like area, as is really well explained in the guideline document from the WHO to resilient and sustainable healthcare, which we'll share the link for in the chat. The health area is also highly vulnerable to the impacts of climate change and an important contributor to the greenhouse gas emission gases. We know that they produce almost 5% of the greenhouse gases. So we know that the COP26 article that Marisol mentioned before, and that was launched also by the UK, Healthcare Without Care and WHO, integrates these two initiatives that Marisol was mentioning before, one in terms of resilience and another one in terms of mitigation, each one with their respective commitments. And we're really proud to see that, as they said, of the over 50 countries that committed to this, there were many countries from Latin America and the Caribbean where there were a lot of policies that are innovative, that are being implemented to implement the adaptation and mitigation episodes. I want to emphasize this because it is not a little thing for Latin America and the Caribbean, that, as the viewpoint really says, with multiple sources of data, is quite an unequal area that faces quite significant challenges to get access to financing in terms of climate change. For example, the first country in the world to include a health area in their NDC was a Latin American country, it was Argentina. So a key message of the viewpoint is that in terms of public policies, both in climate change and health, in the region, we don't only have challenges, but we also have solutions worth replicating in the rest of the world. But this mobilization towards the healthcare that's climatically intelligent is not only being done at regional level, but also as health establishment levels within the green and healthy hospital network with members in 25 countries. We have several examples of hospitals and healthcare centers that are already carrying out vulnerability assessments, adopting adaptation strategies here in Latin America and the Caribbean. We could think that because these are institutions that are in the southern part of the world, and especially in the middle of the response of the pandemic, they would only be working adaptation to prepare to the unavoidable impacts of climate change, but they are also taking on the responsibility on mitigating and also leading by example in that area. Here, we have seen an increasing number of members of the network that are starting to estimate their own emissions, and starting from the understanding that this gives us over the composition of their carbon footprint, they also start adopting plans and measures and goals to mitigate mitigation. I can mention here the 19 institutions of health of the region that have already joined the race to zero, the company of the UN that congregates the largest coalition of the world of players, non-state players that commit to reach zero net emissions by 2050, aligned to with the Paris Agreement. With all these actions, the health area is not only in line with the Paris Agreement, as I was said, but it's also positioning themselves as a key player in climate action, especially through the health professionals who give voice to this claim that we have mentioned, that we consider climate change as a public health problem and to act consequently. This is where I'm going to leave it by now because I had very short time, but I'm happy to hear all my colleagues from the panel on the matter. Thank you, Andrea. Here in Chile, we have been beneficiaries of the work of healthcare without harm, so we know a lot about the work you do. Now, I would like to invite my fellow countrywoman, Jessa Palmeiro, nurse, master's degree in public health and president of the Chilean Society of Planetary Health, who's also a PhD candidate in global health in University College London, to share the reflection on how the training in climate and health favors climate action and population and health. Well, thank you, Mauricio. Thank you, everyone. Thank you, Milena, Jenny, and all my fellow panel members. From our institution, we're really happy of being given this opportunity and for this presentation or this small discussion. I prepared this small presentation. You can see it, right? Okay. Well, the question that we were given was why training, in particular through formal training in climate and health, favors climate action and in itself also favors the population's health. I would like to divide this question into two parts. On one, the climate action and health, and on the other, what is training itself. And really, this is something that many of our fellow colleagues have mentioned that appear in the viewpoints, and it is that if we want to define climate action, well, in general, we're talking about mitigation and adaptation. And in mitigation, we want to reduce the greenhouse gases through different actions: energy efficiency, decarbonization of the energy matrix, reduce the emissions of industry and transportation. And on the other hand, through adaptation, given that we already have a global problem and that we will have it for a while, we have to adapt to this impacts, to these changes in climate. And actions that are aimed at this adaptation are linked to reducing vulnerabilities, especially social ones, to better handling the risk of disasters and a better preparation and understanding the climate processes, because this will allow us to take action in the future. And if we see really this whole thing, we actually see that mitigation and adaptation are maybe topics of engineering, of other areas, but not health. However, it would seem that everything we do on mitigation and adaptation goes towards social development, sustainable human development, and one where the welfare and health of people are put in the center. What we do and what we want is better public policies, because we want people to have better development. Well, that is putting the welfare and development of the people at the center. And all of this leads, this whole climate action and also the social development leads to actions that are transdisciplinary and that lead to collaboration and cooperation actions. And this idea, I link it with the second part of the question, which is, well, why training in climate and health will favor all this climate action and ultimately populational health? Well, because if we start seeing things, actually training is very important, because it will form people, it will form workers, it will form professionals, it will form area leaders, etc., in different sectors, in energy, in the industry, in transportation, in economy, in the area of health as well, even in terms of governance and government and politics. So all of these actions are going to be done by people. And if we strengthen the training in climate and health, not only for health professionals, but also in an even way to all the people who live in this world, well, we'll have people who are aware of this need, aware of this intertwined network of this transdisciplinary action, and also about the complexity it has, as Daniel was mentioning. So when we see, for example, mitigation actions like promoting active transportation, well, here we're not only just talking about the transportation system itself, because this will also have an impact, a positive impact for the social development and the welfare and health of the population. When the person in charge of promoting clean energies or policies of clean energy start working on this, well, they're not only working on that, they're also promoting a better social development and of welfare and of people's health. The same with adaptation. When we have people who are in charge of the urban planning and who consider within their planning the development, the social development, the welfare and health of people, we will also be strengthening the population health. The same as when we talk about climate governance. If we have people who are empowered, are aware of the relationship there is between climate and health, it is very likely that all the policies in different areas will be focused on promoting social development, well-being, and health of people, and therefore to develop this harmonious advance. This was my more presentation. I hope I convinced you all, but training is absolutely key for people, for citizens of today and of the future. Thank you very much. Well, thank you, Jasna, for the enthusiasm that you showed in your message. And the same, I thank everybody here in the panel for their reflections. And before we start with the questions of the public, I would like to ask a question to all of you who are here in the webinar, around 128 who are part of this now, from 15 countries of Latin America. The question is, what are the challenges that the health community of their country must face to maximize the benefits of climate action for health? You can select multiple options. While this takes place, so here's the slide. For those of you who speak English, we have the translation of the question and options also in this slide. Thank you for your answers. Meanwhile, I will ask our panel members to make some comment about the results that start appearing. There's a question also on whether the recording will be available. And actually, Jenny says that it is being recorded and this will be shared with all of you. So also to Maria Elena, I think also from Valdivia, you will receive this recording too. Opinions. Well, I don't know if you can see the results already of the responses from our participants. Yeah, people are voting right now. We have 116 attendees, and we're just waiting for the rest of the people to answer. Can you see the results? Yeah, this is quite interesting to see. Very interesting, in fact. The winner with 59%, the most voted one, is and lack of awareness of decision makers on, well, but I cannot read the rest of the question. And in second place with 48%, small or no participation of the health area, and the third, not a lot of media coverage on health and climate change, 30% gaps in the contents of climate change, And that's pretty much where it stopped now. With 59%, we have the lack of knowledge of the decision makers. So I invite the panel members to make comments about the results of this vote, of this exercise we just carried out. I don't know if anybody wants to give an opinion. Who wants to start? Well, Marisa, this from the options that were available. I think that the participants are really clear that we actually have a problem of governance and lack of information. So in a way, this appeared in some of the options of answer. They appear repetitively or in a similar way, this issue. And well, I think that then the Lancet has in their hands a tool that's very strong, very powerful, of being part of the communication. And we hope that we can have, through these webinars, these events, an increase in awareness and on decision making and the involvement of the health area in the countries and also in the governance processes of the country. So I think that from the point of view of the participants, is an area that lacks development in the Americas. Perfect. Andrea, please. Yeah, just a quick comment that I think covers many of the points that we saw were selected in the survey. Is that sometimes it's not a lack of information, but a lack of social backing. What do I mean by this? In the latest report that just came out, the last one at the beginning of April from the IPCC, tells us that we really have a window of opportunity that's very small, that is closing really fast to make change that are very radical in the structures of our economies to keep this hope alive of achieving the 1.5 degrees by the end of the century. And making these radical changes will necessarily need to touch some interests that enter into conflict. The governments, not only in Latin America, but around the world, in order to make these changes, despite this interest in conflict, need a strong social backup. And I would say that there are a few sectors that are where this is as evident, the way in which we mobilize people in favor of action, than stating it from the health point of view. If we take climate change from the health area, we can mobilize more people to back these actions that are so ambitious and that governments have to take, and also have to highlight the very important role that health professionals have of being communicators, effective communicators of what climate change means for health, and thus trigger this mobilization. Thank you. Well, thank you, Andrea. Now we have Yasna with her hand raised, and it's already almost 7 in Chilean time, so we have very little time, so we'll give Yasna the floor first. Yeah, quite briefly. I think that the responses from the audience are quite assertive, and a while ago we have been seeing a gap there is between the generation of scientific evidence and how this is disseminated. But sometimes climate science is a bit complex to understand because it has very complex terminology. There's a lot of uncertainty in the middle. And how do we move this towards decision makers, towards an audience that was not formed within the lingo of the climate science? And in this gap, we see a great opportunity. And here I'll give the hat to Stella from the Lancet to reduce and maybe bring closer the evidence, the climate evidence that we have, and move it in a friendly way to the people, to the communities, and also to decision makers, because sometimes this lack of knowledge or lack of understanding happens because we just don't understand these two worlds that we see as two worlds apart. Well, thank you, Yasna. So I will give the floor because of the time. Sadly, we don't have more time. I will give the floor to Oh, James asking for the floor. James?
Yo creo que la situación es ¿cómo se dice en español? Chicken and egg, pollo y huevo, gallina y huevo. The policymakers do not know about the health impacts because the health professionals have not told them. So we need to empower health professionals to speak in the community, to the policymakers. This is the most important priority.
Perfecto, muchas gracias. Entonces,
Yes,
gracias.
thank you very much. Thank you for your remarks, James. Now I'll give the floor to finish the webinar to Milena. Remembering that we will try to answer all the questions directly to those who have written them in the chat, in the Q&A chat. So now I'll give the floor to Milena, the liaison officer for America and the Caribbean from the Global Climate and Health Alliance, who is coordinating the Climate and Health Network work. Milena? Well, thank you, Dr. Ilavaca. I will present my slides, and I will speak on behalf of the Secretariat of the Global Climate and Health Alliance, which supports and continues the work of the Latin America and the Caribbean Health Organization. I want to thank the leadership of Marisol Iglesias and of everybody else who was author of this article for their tireless work. I would like to also mention all the organizations that are part of the network and who are joining the conversation on climate change and health, not only at a regional level, but also making the voice of the region stronger at a global level with their great expertise and hard work. We see an alignment and commitment that is quite extraordinary with the network to move forward with our work in health and also to protect the health and the well-being of the population in Latin America and the Caribbean, and to lead the region towards a healthier and sustainable future, more equalitarian and inclusive. So what's happening with the network now? In the annual planning, we proposed a sound agenda for this year in all the areas mentioned by the panel members. The Climate and Health Network will be available to collaborate with the countries and nations of Latin America and the Caribbean, with intergovernment, non-government, and government organizations to provide our expertise on how to develop the opportunities that they're offering in the transsectoral agenda for climate change, the research in the areas of health and climate. It will also dedicate its activity to mobilization of health professionals in the advocacy at a national, regional, and global level, who will support the implementation of mitigation and adaptation policies that maximize the benefits of health and become gains in terms of environment and economy as well for these countries. At the same time, the network will keep on growing, and we will welcome new organizations in the region who are interested in starting or carrying on working on climate and health issues. We invite you to get to know the network in our webpage and to contact us, because climate change is a huge task that only by working together we can address. Thank you. Dr. Mauricio Lavaca. Well, thank you, Milena, for your words. Certainly, climate change is something that we have to address together, and especially from the health sector, where we're taking on a leadership role. To close this important webinar, I give the floor to Dr. Stella Hartinger from CLIMA, who is the author of this viewpoint, and Dr. Jenny Miller, who is Secretary Director of the Global Alliance for Climate and Health. Please, Jenny. Stella first, Jenny second. Well, thank you, Mauricio. Now to finish, and this has been such a beautiful event, I would like to thank our partners in the organization of this marvelous event, but a special recognition to Milena. She's the heart of the network for climate and health in Latin America and the Caribbean, and I think it's an amazing first achievement. Milena, this is amazing, and without your push and without your dedication, this wouldn't have worked. So I will be clapping, but there's no way of clapping, so thank you. What an amazing panel, what an amazing conversation. So thank you very much to all of you who have participated. And I think that to finish, we just only have to highlight what Marisol put in her slide. The health area has to become into an articulating agent of the interested parties, not just from the ministries. It has to be the focus, it has to be the center. We have to be in the center, as Jasna said, and we have to strengthen the intersectoral action through the perspectives and co-benefits of health. Having said that, the following steps is that countries must strengthen the health component in their management and public policy in climate area. In particular, in the NDCs, in the national adaptation plans. Those are the following steps. As Daniel was mentioning, governance is something that is really critical to get to where we have to get. Also, the governments in Latin America and the Caribbean need to take urgent actions to strengthen the health system, as Andrea was saying, because it's the only way of making sure that health is at the center of this national and regional response facing climate crisis. Again, thank you very much for being part of this wonderful event. And I will leave you with Jenny, because I know that she will thank every single one of the organizations that are here with us today.
Thank you, Stella. And yes, I would like to actually thank by name the organizations that came together to mount this event, the Latin America Center of Excellence in Climate Change and Health, CLIMA, the Pan American Health Organization, Salud Sin Daño, Healthcare Without Harm, the Lancet Regional Health Journal for the Americas, Colegio Médico de Chile, la Sociedad Chilena de Pediatría, y la Sociedad Chilena de Salud Planetaria, and the rest of the organizations that are current members of the Network for Climate and Health in the Americas and the Caribbean. And then also, just as we close, I want to thank everyone who attended this webinar and who is interested in this topic, who is interested and concerned about the threat that climate change poses for people's health, and who is interested in thinking about solutions to that problem. On behalf of the network and on behalf of the Global Climate and Health Alliance, we look forward to working with you. We hope you will reach out and partner with us. As Milena mentioned, this is a big challenge for humanity, and we need to work together to address it. So counting on all of you to come with us on this journey of finding solutions to this problem. Thank you to everyone, and have a good rest of your day or your evening.
Gracias, Jenny.
Ciao.
Muchas gracias.
Thank you, Jenny.
Todas.
Gracias a todos y a todos.
Muchas gracias por asistir.
Thank you for being here.